Alright, good morning everyone. So without saying too much today, I'll be dropping an episode again concerning the usage of two drugs. That is now the order of the day. Are you getting the point? So take a look at this drop here, this drop here, and you take a look at this one here. Get the point? This is what is it called? Postinor, either by 2 or by 10, never mind. And this one is misoprostol. They have a lot of things that is going on between these two contraceptives. Both of them are contraceptives, you understand? Yes. But they have something very important that is going on in between them that we have to talk about today. I mean, they have a little misunderstanding that we have to throw light on. Are you getting the point? So let's see in this direction, or in this field now, for instance, that immediately that you meet with your guy, all those ladies now, then you went ahead and take postinor, either by 2 or by 10, and never mind that postinor. Then that is for Mrs. A. Then Mrs. B went ahead and take misoprostol. Then let's cross-check both of them. Then let's start from postinor because that is the one at the first one. The first one I mentioned. We talk about postinor. It's actually talking about the contraceptives that is used. Get the point? Immediately, some girls use it immediately after gestation, which is sexual intercourse. So what this postinor do is, let me just list some of the things that it do, because some people don't still know if you take drugs how it works. That is the best thing for you to understand. For instance, you take paracetamol either for cold or for headache. Then you actually take this paracetamol into your stomach, you get. But at the long run, you see that it relieves your pain, your migraine, your headache. You relieve it once. You don't even imagine that how come that something I take into my stomach have to work with my body. Get. So let's talk about that now. If we take this postinor, first and foremost, it is either it increase the cervical mucus. Your cervix, the mucus, it will increase the cervical mucus that now hinder sperm in reaching the egg. That's the first thing. That's the first thing that you can actually face when you take this or what is it called, postinor. And secondly, he said that it attack the sperm and make sure it will weaken most of the hormones that make it active. That's the another thing for you guys. Get. Then thirdly, he said that it actually make sure that it make the cervical lining more thinner. I getting the point that the sperm will not be able to pass to the egg. Let's just stop in these 3 things first. Let's stop at these 3 things. Now let's go back to misoprostol. I getting the point. Misoprostol is something that many people have actually think it's under misconception because they don't know that even this misoprostol of the thing actually work. Let me explain everything in details to the layman understanding or to the lay person understanding. If you talk about misoprostol as a part of medication so far, then you don't have to forget the treatment of what is it called, unnecessary non-steroidal anti-inflammatory drugs also. Because some people might be hearing this for the first time, that even this misoprostol you take for pregnancy termination, you can also work for ulcer effectively. They don't know. This is the first time. Some of them, this is the first time. I can guess that 60 or 55% of healthy individuals or of normal lay person don't know that misoprostol can be used for what is it called, a severe ulcer caused by the non-steroidal anti-inflammatory drugs such as your ibuprofen, Motrin, diclofenac, sodium, potassium, others. So if your ulcer is caused by all those, they said you can use misoprostol to control it. Fine. Then the other work that you do is that you terminate pregnancy. The one that all of you know about it here. That misoprostol, I want to share my experience that I've seen practically in this world. I mean, how it works. Do you know that you cannot try or risk it 2 times medication? I mean, take it 2 times. No, misoprostol is always 40 minutes. When it comes to the agency of what using it to terminate your pregnancy, you will have to take 2 and you will insert 2 on your vagina. Yes, fine. If it is like this, for instance, if it is like this, and you take 2 and insert 2, and maybe the work there is to go and flush the uterus. Fine. Let me assume that he's going to go and employ the uterus. This thing when they employ the uterus jelly and comes out. I mean, as time goes on, be on pad, take it in the night before sleep, be on pad, and then the next morning you will see bleeding. You will bleed off. You get so. If that's the case, you already bleed off. You know that you shed blood very well, and this thing went there to go and clean the uterus that's containing your what is it called fertilized embryo. Then if it is like this, then you have the call and said this thing, don't think that it work well. Some people actually listen to your body, not medically, but personally. I get in the point. If you are not a medical practitioner, you don't have the gut to suspect anything at all because you don't have any knowledge about it. For an instance, you see that your stomach is full, and all of a sudden you said it's like my appendicitis is what inflamed. My appendix is inflamed. Sorry, that is appendicitis. Or you said I have a hernia. Never, don't even say you have a hernia. You just said I'm suspecting. It's under suspension. You are suspecting this. That is under medical because scan will be the one to bring out the true result. Scan. I get to the point. So if that is the case, now, okay, it's going this way. Then you have the gut again to go and take that misoprostol second time. You have the gut to go and take the misoprostol second time. Then it can actually create a minor injury on your uterus, which is going to constant bleeding. That time they will say you should prevent it with regulatory or vitamin K, all those ones. Before you know, you put problem on your own self. This is another thing to talk about. Yes. So since we have actually know the meaning and as well the usage of these two drugs, misoprostol, postinor and misoprostol, I think the next thing to know is the side effect, the possible effect. Nausea is there. You might tell them misoprostol or postinor, then you will be nauseating. Then you see vomiting is there, then abdominal pain. You know the overall of it, I mean the general overseer of them, if you cross-check side is hormonal imbalance. I mean changing your menstrual flow in the next month. You take it this month and you are fine. You are fine now, okay, I'm okay. We have many, there's what they call cryptic word pregnancy. That thing we'll talk about that one. Whereby a lady might be pregnant, he or she will not know. She will not know that she actually pregnant. You get it? 1 month you don't know, 2 months, I mean she keep on seeing her menses. 3 months she don't know, 4 months. I've seen a patient, God, I've seen a patient that have been pregnant for almost 9 months. The day she's labor, is that day. They were certainly thinking another problem until the nurse confirmed that she's pregnant for the past 9 months. And it's time for her to give birth. So it depends. But what I'm trying to say, that is by the way. So you see, this hormonal imbalance is one of the general and as well major side effect of both postinor and also misoprostol. You get your menses might be mixed. You can be seeing this menses on the 4th of every month. Then it will add extra 4 days to it. It will now be on the 8th. It is because of the contraceptives you have taken, either the postinor or the misoprostol. Then you can be seeing your menses as normal, but as comes up this time around, it will be lighter or it will be darker. Then your misoprostol can be flowing as normal as well, but as time goes on, by this time around, your menstrual flow will now be thick. These are the things you have to understand. And as time goes on, it will go back to normal. Don't be afraid about that. It will go back to normal. So if you must take any of these contraceptives, this thing, misoprostol, what is it called? Postinor should be taken. You should administer postinor either 72 hours after gestation, which is sexual intercourse. Then misoprostol, if you must take it, that one is if you must take it. That one is not that mandatory. But if you must take it, it's artificial, but it's not that mandatory. If you must take it, make sure that if you take it once and you see the effect, don't try it again because you might have uterus injury, minor uterus injury. You know what I mean? Before you know it, start bleeding, and that one is another dangerous issue. So in our next video, we'll be dropping something very, very important concerning cryptic pregnancy. That is our next thing. So you guys should follow and make sure that you like, comment, and share this particular video and wait for more. Thank you very much.